It is a privilege today to introduce our glaucoma icon, Carolyn Edwards. As Carolyn finds her way to the stage, I will proceed to tell you a little bit about her. It's my honor to introduce someone whose personal journey with glaucoma embodies resilience, hope, and empowerment. Carolyn was first diagnosed with glaucoma in 2006, and since then, she has navigated the complexities of this disease with determination and grace, managing a treatment path that has included multiple eye drops and several procedures. Originally from Houston, Carolyn's life has taken her across the country, working with 7 different glaucoma specialists along the way. Through it all, she has remained deeply engaged in her care, passionate about the importance of taking ownership of one's health. Glaucoma runs in Carolyn's family, which has only strengthened her commitment to supporting glaucoma research and raising awareness. She was first drawn to the Glaucoma Research Foundation because of its dedication to finding a cure. And over the years, she's become a valued member of the GRF community, contributing her voice to several programs and initiatives. Please join me in welcoming a fierce advocate, a generous supporter, and a truly, truly inspirational member of our glaucoma community, Carolyn Edwards.
Good morning. Whoa, too loud, not loud enough. Okay. First, I just want to say what an honor to be here today, and a big thank you to the entire GRF staff and all of the other presenters. I'm going to do my best. I was very humbled when I was asked to speak today. I realize it's harder to speak about yourself than it is to do anything else in business and, talk about something you're an expert in, but I'm thrilled to be here because one of the things I've learned about glaucoma is that as you speak about your own story, you always make connections with other patients. Hopefully you help a caregiver, and you give your own insight. So I'm going to start with a story related to my locket. This was my grandmother's, Oralee O'Donnell, and there you see her. That was in my short hair girl days. With one of my cousins. Oralee was diagnosed with glaucoma in her early 70s. She didn't have any history of eye disease, and she wasn't getting regular checkups, so her glaucoma was diagnosed pretty late, later than I think it's fair to say any of us wishes. Within a few years, she was legally blind. She couldn't drive, she couldn't bowl, she was an active volunteer. She was just this incredibly vibrant, energetic woman who didn't lose that, but all of a sudden, first she was legally blind, and then by the end, she had nothing but light perception. So, here I am in my 20s, watching this happen, and just knowing it was difficult. I remember my mom saying, gosh, if only she had been getting regular eye exams, she likely could have preserved her vision. There's no way to know that, but that's what we think. So Oralee's kids and grandkids were all told that glaucoma can be hereditary and that we should make sure to get regular screenings. I was really nearsighted, so I was already going to eye doctors on a regular basis. Started to mark that glaucoma box on the questionnaires. You've probably seen that. And at the time, the only way to check your pressure was that awful air puff. Anybody else had that? And then the doctor would say, well, don't worry. I was still in my 20s, early 30s. You're too young to get glaucoma. So this went on through my 30s. Eventually, I was nearsighted enough. I was really struggling with glasses and contacts. I decided to get LASIK. I had a clean, exam beforehand. My eyes were great. They were healthy. And LASIK worked. All of a sudden, within a day or two, for any of you who've had it or know somebody, it really feels pretty miraculous to somebody who has been very nearsighted. So I thought, oh my gosh, I have perfect vision. This is amazing. Unfortunately, that didn't last very long. So I went in for my 6-month checkup, and the surgeon who had done the LASIK had delegated follow-up care to his new associate. She happened to be a glaucoma fellowship-trained physician, and she did the check, and she said, your optic nerve looks a little suspicious. I didn't know what that was. I didn't even really realize that that was related to glaucoma, but she said, I see you have a family history. I know you're young, but let's do some tests. Within probably 2 hours, I had done a visual field. She had, checked my optic nerve. She had done a couple of the other scans, and I left with a prescription for eye drops after hearing, you have glaucoma, definitely in one eye, possibly in the other. So I was 39 years old. I guess so much for being too young. So I was the oldest of 4 kids and 18 grandkids, all on my mom's side of the family. And my glaucoma specialist said, make sure everybody else knows, because you've now got, yourself and your grandmother, what about your mom, what about your siblings? So within a couple years, my sister Susan, who's here today, lives in the Dallas area. Hi, sis. She was diagnosed, and then not necessarily, I think, the norm, but I don't know what's normal about glaucoma. My mother was also diagnosed a couple of years after that. So that's the family history part. Kind of back to my case. Over the next few years, I had great case. Oh yeah, there's the whole fam. I forgot that was in there, but hi, Susan. So over the next few years, my visual field test, again, I had some great doctors. I was being regularly seen. I had one of those cases where my glaucoma has progressed despite what I believe was, really great, excellent care. I was starting to lose a little bit of central vision in my left eye. I couldn't detect it. I'm sure a lot of you can relate to that. But eventually, at that time, I lived in Chicago. I had an exceptional specialist. We tried, again, a couple mixes of drops. I had SLT performed. Eventually, he said, you really need a trabeculectomy. It's a major surgery, but I feel strongly that this is what you need in order to give you the best shot at preserving your vision. I didn't believe it. I'm like, prove it. He did a, head MRI to make sure it wasn't something else going on, but ultimately I agreed to the surgery. It was mostly successful. When you're younger, some of you might know the incision tends to scar over, and I have had some of that. But I did have pretty much every complication you can have after that. I had hypotony. I had to be followed really closely. We were talking at a table with my new friends from New York. I had to see an extra specialist in New York City because I was there for a meeting, and all of a sudden I had a red eye, a couple of weeks post-surgery. So I went through all of that, but ultimately my eye healed, and the vision in that left eye has been mostly stable for the last, it's now 13 years. But then in 2017, I woke up. I tend to get red eyes from all the drops. They're sensitive. No one's exactly sure why. But I went to the doctor because it was redder than normal. Sure enough, my right eye, which was the one with less glaucoma damage, had developed uveitis. So I don't know if there's anybody else in the room who knows what that is, but it's an inflammation in the eye. My pressure was in the 40s. They got it under control. It's not recurred. I know that it always could. But in that, I had a MIGS procedure. I had the Omni system in 2022, along with the cataract removed because it was being treated with steroids. And you tend to develop cataracts more quickly. So, I guess what I would say about my eye health journey is, as it relates to doctors, I was in a cycle of transfers. I was in a career where I needed to move around a fair bit. I had had 6, now 7 different glaucoma specialists, and part of me wishes I had had that continuity of care because I know that there's some benefits to that, but I also think I learned a lot meeting and seeing and spending time with different excellent specialists looking at my records and giving me their kind of opinions on what was going on. So each of the specialists has a little bit different opinion about what's gone on with my eye. Some of them think perhaps, I've had a little bit of uveitis in both eyes. They don't know. None are sure if the two are related, but everybody's interested in my family history. So that certainly is a part of it. If you're here today to, I think really think about it's important. So I just reflect often about how much we still don't know. Glaucoma is a complex disease. We all have the tags. I didn't even pick what I have beneath regular glaucoma because the doctors aren't even sure if I have low tension or open angle. Does it matter? Is it something different going on? But I was lucky. So unlike my grandmother, I was diagnosed really early. And even though I'm in that small percentage of patients who's lost some vision despite aggressive treatment, I'm positive my vision impairment would be worse had I not been seeing eye doctors regularly in my 30s because they caught it really early. I'm sure some of you have had the same experience. I sit in a doctor's waiting room and you hear stories that people have waited months for an appointment. They can't get insurance approval. They can't get their medications approved, they can't get the procedure that the doctor thinks is best for them approved. That's where the advocacy piece comes in, right? We're all responsible for listening to the doctors, taking what they say very seriously, and then making our own responsible decisions. Talk a minute about mental health. You know, I mean, how many of you were scared when you got diagnosed? I was, yeah, and you know, I was at first, and then I thought, okay, my doctor reassured me most people don't go blind from glaucoma. I thought, okay, take a deep breath, you know, it's gonna be fine. And then I started to lose some vision, again, despite being treated. You know, I think that you have to find that balance. And for me, educating myself through Glaucoma Research Foundation, any sort of credible organizations, information that you can get, again, that you know is credible, because there's a lot out there, right? We could all be Dr. Google and, you know, go into our doctor's office with a million questions and ideas that might or might not have validity. But I came to the first patient summit in 2019 after mostly being involved remotely, and I just left so inspired by the group and by meeting the patients and the physicians. It was wonderful. So to sum up my experience, get those eye checkups. If you've got a hereditary component, please make sure that your family knows that. Number 2, educate yourself. The fact that we're all here today, that's a big step, right? So congratulations. Number 3, take care of your mental health, right? Really important that you find that balance. Number 4, find the best glaucoma specialist that you can based on where you live and what your insurance situation is. If you aren't comfortable with the relationship, then work on it. And if that doesn't work, you might need to look for a different specialist. Know that that's out there, and any good specialist should be open to your getting another opinion. Number 5, advocate for yourself. We talked about that, just really, really important in my opinion. And if you speak with anybody on the staff, or Dr. Smith said it, let them know you're interested in working more and helping and supporting the organization. Look, it's been an honor to share my story with you today. I really hope that each of us makes some new connections. I hope that you leave today's summit feeling empowered to advocate for ourselves and to advocate for our loved ones, because I know that there are a lot of patient support in the room, and that's also incredibly important. So if this is your first exposure to GRF, I mean, wow, what a way to start. If you're a regular supporter, thank you. And I'm really excited to reconnect with some old friends that I've made at past events, to meet some new patients. And again, just a big thank you to all of the physicians here, all of the researchers, all of the sponsors, and I hope I get to hear your stories as the day progresses. Thank you.